The Xulane patch is a type of birth control that contains a combination of two hormones, progestin and estrogen. It works by preventing pregnancy and is not effective in protecting against sexually transmitted diseases. It is important to use an additional barrier method, such as condoms or dental dams, to reduce the risk of infection during sexual activity. Always consult with your doctor or pharmacist for more information on how to use this patch effectively. The recommended dosage is to apply one patch weekly for 3 weeks, followed by 1 week without a patch. It is best to apply the patch on the same day each week to ensure its effectiveness. Before you start using the Xulane patch, make sure to read the information leaflet provided by your pharmacist. It contains important instructions on how to use and dispose of the patch properly. If you have any questions, ask your doctor or pharmacist. When applying the patch, make sure to place it on clean, dry skin on the upper outer arm, abdomen, buttock, or upper body where it won't be rubbed by tight clothing. Do not apply the patch to your breasts or on red, cut, or irritated skin. Also, avoid using lotions, creams, oils, powders, or makeup at the patch site, as it may affect how well the patch sticks. If it's your first time using the patch, apply it on the first Sunday following the start of your menstrual period or on the first day of your period. For the first cycle, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy. Change the patch once a week on the same day and then have a week without wearing a patch. After that week, apply a new patch whether or not you have your period. If the patch falls off, reapply it or apply a new patch within 24 hours. When removing each patch, fold it in half and discard it in the trash away from children and pets. If you have any questions about switching from other forms of hormonal birth control to the Xulane patch, consult the information leaflet provided or ask your doctor or pharmacist. Some side effects of the Xulane patch may include skin irritation at the application site, nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change. You may also experience vaginal bleeding between periods, especially during the first few months of use. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. This medication may also raise your blood pressure, so it's important to monitor it regularly and inform your doctor if the results are high. Serious side effects to watch out for include lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, yellowing of the eyes/skin, and rare but serious problems from blood clots such as chest pain, sudden dizziness, or vision problems. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice any symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed here, contact your doctor or pharmacist. Remember, this medication has been prescribed to you because the benefit to you is greater than the risk of side effects. Always follow your doctor's instructions and consult them with any concerns. Using the Xulane patch can increase your risk of stroke, heart attack, blood clots, and high blood pressure if you smoke while using it. This risk is even greater if you are obese and over 35 years old. Do not use this medication if you are obese or if you smoke cigarettes/use tobacco and are over 35 years old. The amount of estrogen you get from the patch is higher than most birth control pills, which may increase the risk for blood clots or other side effects. It's important to talk to your doctor for more details about the risks and benefits of using the Xulane patch. Remember to use it as directed and at the same time every week to ensure its effectiveness. Before using the Xulane patch, Transdermal weekly, it is important to inform your doctor or pharmacist about any allergies you have, as this product may contain inactive ingredients that can cause allergic reactions or other problems. Additionally, it is crucial to discuss your medical history, including any history of blood clots, high blood pressure, cancer, heart problems, liver disease, diabetes, and any recent or upcoming surgeries. If you weigh more than 198 pounds, this patch may not be as effective for you, so it's important to discuss your weight with your doctor to determine the best form of birth control for you. For individuals with diabetes, this medication may affect blood sugar levels, so it's important to monitor your blood sugar regularly and report any changes to your doctor. It's also important to inform your doctor if you are planning to have surgery or if you will be immobile for an extended period, as these conditions can increase the risk of blood clots. This medication may also cause skin discoloration, so it's important to limit sun exposure and use sunscreen when outdoors. If you are nearsighted or wear contact lenses, you may experience vision problems, and if you are scheduled for an MRI test, it's important to inform the testing personnel that you are using this patch. Lastly, this medication should not be used during pregnancy, and if you are breastfeeding, it's important to consult your doctor before using this medication. It's important to be aware of any potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Don't start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Xulane patch, Transdermal weekly include aromatase inhibitors, fezolinetant, aspemifene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. There are also some drugs that may cause hormonal birth control to work less effectively, leading to a decreased amount of birth control hormones in your body. This could result in pregnancy. Examples of these drugs include griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, and certain HIV drugs. If you start any new drug, be sure to inform your doctor and discuss if you should use additional reliable birth control. Also, let your doctor know if you experience any new spotting or breakthrough bleeding, as these could be signs that your birth control is not working effectively. Keep in mind that this medication may interfere with certain lab tests, potentially causing false results. Make sure that lab personnel and all your doctors are aware that you are using this drug. If the Xulane patch is chewed or swallowed, it can be harmful. If someone has taken too much of the medication, remove the patch if possible. If serious symptoms such as passing out or trouble breathing occur, it's important to seek immediate medical attention by calling 911. Otherwise, contact a poison control center right away. U.S. residents can call their local poison control center at 1-800-222-1222 and Canada residents can call a provincial poison control center. It's important to take the Xulane patch as directed and to follow the recommended dosage and timing for optimal effectiveness. It's important not to share the Xulane patch with others. Make sure to have regular checkups including lab tests while using this medication. Your doctor will provide instructions for examining your breasts, so be sure to follow them and report any lumps immediately. Keep all medical and lab appointments, and consult your doctor for more details. If the Xulane patch comes off or if you forget to remove it at the proper time, refer to the product package information or how to use section for instructions. You may need to use backup birth control, such as condoms, spermicide, to prevent pregnancy. Ask your doctor or pharmacist if you have any questions. If you have trouble remembering to change your patch, or if the patch often comes off, contact your doctor to discuss switching to another form of birth control. When storing the Xulane patch, Transdermal weekly, it's important to keep it in the protective pouches at room temperature, away from light and moisture. Make sure to store all medications in a place that is inaccessible to children and pets. It's crucial to not flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. When the patch is expired or no longer needed, it should be properly discarded. Refer to the How to Use section for more details on proper disposal. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.